Welcome back. It's Ekse right here on Cape Town TV, the best entertainment show in the land. Engcobo yakho, Engcobo yam, Engcobo yethu sonke. What about now? We're joined by someone who's very inspiring, Lama. Born and raised Engcobo, she is one of the few female doctors in the country to practice in neurosurgery. Do you know what that is all about?
I do. I'm so intelligent.
Can you take a guess?
They operate in Rwanda, like the brain.
Yeah.
And Umkolo, I guess it has to do with the spinal cord. I don't know. The doctor is going to tell us.
Well, doctor, welcome on the show.
Thank you for having me.
Unjani?
Ndiyaphila khondo ninjani nina?
Ndiyaphila. Ulama took a wild guess. He thinks he's a very smart person right here. Tell us, what is the world of neurosurgery all about, the field?
He is actually pretty much spot on. As neurosurgeons, we are responsible for treating people with conditions of the brain that need surgical intervention. So the ones who will have tumors or will have blood in the brain or brain has been injured, those are patients who come to us. And also people who are born with certain abnormalities of the brain and also of the spine. Also we treat, of course, the spine, the bones, when they're aging. You know, they usually come to us for us to actually correct whatever the problem is that is due to age. And also, of course, we also operate on the actual spinal cord itself. Abantu tend to confuse the spine with spinal cord. Now, when we talk about spine, we usually mean the bone, and then spinal cord, we actually mean umqondo, you know, which is the actual thing that actually is, you know, running through that canal is spine.
Okay, there we go. Doctor, when did you first fall in love, or when did you realize that you're actually attracted in the field of neurosurgery?
Right in varsity medical school. So I was in UCT for my undergrad, which is my first degree, you know, the one that you do to become a medical doctor. So I think around my third or fourth year, I already became interested in neurology, neuroanatomy thing, you know, but at that time I was not really sure what I was going to do. Was it going to be neurology? It could have been psychiatry or neurosurgery. And then I was invited to theater by a guy who was one of my first mentors, Dr. Kachinga Sechizia, who was a registrar at the time in Grooteskier. And he takes me to theater with him in Grooteskier where he was removing a brain tumor. I was sold on that day, but this is what I want to do forever, you know. And right from there, I completed my medicine at UCT. Then I went on and did my internship and community service. Immediately after that, I didn't hesitate. I went looking for a post to train to specialize. And that landed me at Gauteng, which is where I got a post and started training in Victoria. So I fell in love with it as an undergrad, you know, and it's a university and sent the degree.
Wow. In neurosurgery, you specialize in neurosurgery, and it's a field that is dominated by men. There's few women who are entering the field. What is it about this field that women choose to stay away from?
Look, I don't think women necessarily choose to stay away from it, but I think that the conditions are made such that it is not attractive for women to actually go into it. Women naturally would want to do anything and everything that they like as well, but the problem is that the circumstances and environment is sometimes made to be very hostile so that you don't even consider it. So it has, of course, very demanding long hours, you know, and some would say that for those reasons, they don't really want to do it because, you know, they want to have families and such. But even if you choose not to have a family, you know, you still will be discriminated just like any other, you know, woman who goes into the field. So there'll be people who actually even insinuate that you are not good enough just purely because you've got ovaries, you know, and that of course made any sense to me, you know. So it is not necessarily that women are choosing to stay away from it. I think that many women are interested, and actually many women can be very good and are very good neurosurgeons around the world. But if the environment is not enticing and attractive for them, they then stay away from it.
Well, Mfundisi is not only your surname, you actually practice, you live by that surname. Dr. Ncumisaji Lata is one of the youngest, if not the first youngest doctor in neurosurgery. And you played a huge role in mentoring her while so how important is it kule field yenu ba kube khona umuntu ozokwazi ukumentorisha?
When you decide to do something as challenging as this,
Yeah.
and in an environment where many have not gone in, people like yourself, I mean Black women particularly, you need someone else who's going to understand your struggles and who's going to pretty much, support you, not hold you by the hand per se, but just support you and be there, so that at times you can vent when you're feeling frustrated. So mentoring for me has been very important. I have mentored ladies before, particularly because it tends to be Black women. I've also mentored some men as well, but it has been most important for me to mentor ladies going into these fields such as neurosurgery, because I didn't want anyone to experience neurosurgery in the way that I experienced it, where I felt I didn't have much support, where I felt that my development was not prioritized. I was being held back at times purely because I'm a woman, but not because of competencies. So I didn't want any other person who goes in, Ofananam, Black woman, to experience the same difficulties I experienced. So I was trying to, but because I wanted to then make it easier for them and just to assist them to develop less painfully. So mentoring for me is everything. Mentoring is very important. And so I did for Dr. Chilata what I had hoped could have been done for myself by another woman.
Yeah, since you've mentored Dr. Ncumisa, have you seen change since then? Have you seen more women entering the field? Have you seen more learners registering for this kind of course?
Without a doubt, without a doubt. So when I started training in Pretoria, so I was the first woman to actually qualify from Pretoria, Black or white, any race.
Wow.
Over 100 years had not qualified a female neurosurgeon, So then after that, Dr. Chilata joined us, and after Dr. Chilata joined us, then immediately there were 2 other women who were joining. So there are more and more women going in. So for a good 4 years, I was the only woman in the department.
Yeah.
But then now departments are looking very different. Many are having more and more women. But also, I think that the Society of Neurosurgeons recognizes the challenges of not having women in neurosurgery and actually wants to change that. And so they're encouraging the institutions that are different institutions in the country to have women in their departments, and also to cater for women so that they actually can find the field attractive. Look, there's a lot of benefit. I always say, when you reduce your pool of talent purely according to race or sex, you're actually not going to get the best of the best, And in order for you to get creme de la creme, you need to make sure that you expand your pool of talent and pick from women, colors, different colors, and also from different gender spectrum. So you should not confine yourself to just saying, no, I'm going to go for women, because you're going to end up with not very talented people at the end of the day.
Well, the field Guyo doctor is perceived to be one of the very complex. So how, really, especially if you're a patient, how do you prepare your patients, and what feedback do you usually get?
Not preparing a patient is a difficult process, because many times you are not giving them a good news. Because once you're diagnosed with a neurosurgical condition, many people see that as a death sentence. You're needing brain surgery. Am I ever going to make it? I'm not going to live. I don't want to do it. I'm too scared, and all of that. They've heard horror stories. And look, the bottom line is that we have a history as neurosurgery, that maybe our outcomes were not great before at some point in the progression of the field. But we are continuing to improve, and some things are actually now almost unheard of. Some deaths in certain conditions are almost unheard of. So I always, of course, encourage my patients to speak up about their anxieties as I make the diagnosis, and just have an approach of saying, look, I do understand that to you, whatever I'm saying is for the first time you're coming across this kind of news. But I do it every day. But every single time I'm seeing a patient, I'm going with them as if it's the first time I'm discussing that particular condition, that kind of a tumor. And because we do that with patients, great patients, that tends to then, when you establish a rapport very quickly with the patient, and we find that patients actually now agree to surgeries, and they actually see the outcomes, the good outcomes on some of them. And of course, when you don't think things are not going to be great, I'm upfront. I tell them in a most sensitive and kind way that, look, I don't think operating will help at all, or even if we operate, we're not going to necessarily prolong life and all of that. So I usually have to break this news. And I tell you that I've established very strong bonds with my patients, and of course my patients' parents as well, because I treat a lot of children as well in the public sector. So those bonds, they've been very, very fulfilling, because, this person who feels that they've got someone they can talk to, you know, about their problem and about their condition. Sometimes I end up doing some marriage counseling as well.
Yeah.
You know, because of the work that I do, you know, because the families are struggling with what they do. Not to say that I'm a professional marriage counselor, I will not even claim that, but, you know, I understand the anxieties and the difficulties because I had seen so many parents going through, for example, a child who's chronically ill or terminally ill. So, and the patients, I think, that enjoy the interactions with myself.
Yeah.
Okay, we are running out of time, but I just want to ask one or two more questions. If you could give us 2 more minutes, Director. When you're not at the theatre, Ekse understands when Dr. Mfundisi that you are actually there in the community giving back, which is very important and
very
rare
rare to
because
find.
abantu
Yeah.
busy. So tell us more about that.
So I do a lot of awareness around brain injuries resulting from road traffic accidents. So you might have picked up that recently I was in Mthatha giving, safety vests and also stop signs to assist children to cross the road. I treat children a lot and they're very close to my heart, and when their brains are injured, I am not very happy. So whenever we can prevent it, I want to make sure that I do a lot of education with communities and also just advocating, you know, for better road traffic use and also to prevent and minimize injuries to children. And also, of course, to adults as well. So I do a lot of education that I do via my Twitter handle and also just going to speak to certain communities.
What's your Twitter handle?
Yeah.
Ekse Mfundisi and Dr. Mfundisi.
Well, that sounds amazing. Quickly, before we let you go, what advice do you have for young girls across the country who want to follow the same career path?
Young girls, nothing is stopping you. Go for it. We are here. We're going to hold your hands as you're going through it. Do not fear anything. Do not underestimate yourselves. You are talented. You are gifted. You must go for it, and we will hold your hand, and I will kick anybody who's standing in your path.
Yeah, man. Brain damage because of operating. Thank you so much for taking time out to chat with us.
Thank you very much.
All right, then.
Well, that is, of course, beautiful, Dr. Dr. Mfundisi, all the way from Engcobo. Guys, everything in this country is absolutely possible. Hearing that, I'm so inspired. But right now, I'm going to take a quick breather. More to come right on Ekse. Asibuye, ungayi ndawo.